Hello, this is Karen from CliniSync, and today I'm going to do a short demonstration on the Community Health Record. The CliniSync Community Health Record portal is where you'll find contributions from hospitals and providers such as demographics, face sheets, and results or reports such as lab reports, radiology results, and such. So what I'm first going to do is navigate to our portal, and then I'm going to enter my username and password. And then I'm going to click log in. After I log into the system, the very first screen I'm going to see is the patient search screen. So here at the top left of the screen, you'll see a few tools that are available within the Community Health Record. So the results inbox, referrals, and direct messaging. So let's go ahead and search for a patient. And you'll notice here it says to enter name, MRN of the sending facility, SSN, or date of birth. What is usually best is first name, space, last name, space, the date of birth, which would be 2-digit month, 2-digit day, and 4-digit year. I'm going to enter a test patient. So my patient's first name is ADT4 and the last name is Test. I'm going to just click on search. So when I click on search, the patient criteria will come at the bottom. If I want to see if there's additional information on the patient that I was just on earlier, I can click clinical non-emergent and access additional records. So here I do see that there's another patient by the same name that displays. However, if I look here at the top, I see the patient's name, date of birth, last four of the SOCH, and gender. And I know this top patient is the patient that I need to view. So I'm going to go ahead and click the record to bring up the summary page. So here at the top is the patient ribbon. So within this patient ribbon, you'll see the patient's last name, first name, gender, age, and date of birth. Now let's just move along the ribbon and let's start at the top here and create a care summary. So a good use case for creating a care summary would be maybe you received a referred patient that you've never seen in your practice before or your organization. So you may want to pull the records out of the community health record in order to absorb them into your EHR. So as you'll see here, the document details looks very similar to any other CCD or continuity of care document. And just depending upon all the records available for the patient will determine how long this particular document is. Okay, so you do have some options here. So you can click on download, and that will download in a CDA format. If your EHR is capable to pull that in, you'll be able to do that. You could also print to your local Windows printer, or you could print a PDF. So you could pull it into your EHR system. Then underneath, we'll see that there's profile and face sheet. So let's click on profile and face sheet. So under the first screen here, under my tab, we have demographics. So if we scroll through the demographic screen, you can see general information available about the patient from data contributed from our partners. In the next tab is the face sheet. Likewise, the face sheet will list data that has been contributed from the data contributors. You'll notice at the top as I scroll through that the patient ribbon stays here at the top for you so you know that you're on the correct patient. Okay, so now let's move back into the patient summary screen. So I'm going to click on patient summary and we see the patient summary. The patient summary serves two purposes. The first being to show you the most 3 recent contributions in each of the various categories, and it also will launch you into that particular location. So if I clicked on the results here, we'll notice that it launches me into the results section. Okay, so let's go back to the patient summary, because I do want to point out one item that you can configure it to your liking. So this would be a sticky setting for the user logged in. So if there are some things that you don't use or some things that you would like to be first on your screen, you're able to customize that. Okay, so let's just follow straight down here and go into the encounters. In encounters, we'll list that visit level detail. So let's just scroll down here. Again, this is a test patient, so there's just one here. But as you can see here, we can either click to view all the information or just view the face sheet from this particular encounter. So here we can see the encounter details, such as the labs and things of that nature. Now, how we were able to create a continuity of care document in that CDA structure, we can do the same with the encounter level or the visit level data. To do that, just click on Encounter Summary, and it will display, again, following the same table of contents, just less information because it's just isolated to the singular visit. You'll notice when I create these documents that they will highlight under the Documents tab. That is because when you create what I call one on the fly, it will temporarily store under the Documents tab, and we'll talk more about that later. Okay, so next, let's go ahead and move into the results section. So the results will display below. They will look similar no matter which hospital or practice contributed the particular results. You can click on them to view. If the result were abnormal, it would be bolded in red to draw your eye in. And again, you could also print or print a PDF for these particular results. As you can imagine, over time, there may be several results contributed for a patient, so there are these handy radio buttons where you can turn the data on and off to help with your searching. Okay. The next item we're going to look at is medications. So under the Medications tab here at the top, you're going to see allergies. We will let you know that for the most part, allergies within the community health record are isolated to food allergies, but you may see some drug interaction allergies as well. Another item that unfortunately we cannot show because it's only available in the live environment is in this area you will also be able to query the ORS database. And again, that's for the prescriber or their delegates. There will have a button here to be able to query the ORS database and pull back those records. The last item on the list is documents. So under documents, you'll recall that I stated that the items that I created on the fly, so that large care summary that I created and the encounter level summary are here temporarily for my use. When I navigate away from the Documents tab and away from this patient, actually, those will clear out. However, what will stay here permanently is any CCDs that are contributed from hospitals or long-term care practices and such that are meant to live here in their static form. So as we move forward, you will see additional information available under the Documents tab. That concludes our demonstration of the Community Health Record Query tool. Thank you.